Welcome back. Once again, we have our longtime friend and physician, Dr. Craig Walker, who's played many roles over the years in research and development. We've had stent programs. We've had all kind of things with Dr. Walker over the years. But tonight we're going to talk about venous disease. If you're watching tonight and you want to call up, the number will be in the bottom of the screen. And give us a call and give us a question if you would like, okay? All right. Let's simply start off. What is venous disease?
Sure. Well, let's understand the word circulation. Circulation was a word that William Harvey came up with, and it means circle. That's the basic word. And the circle is the heart pumps blood out. The blood is pumped out to the arteries. It goes down to the tissues where it gives off oxygen and nutrients. It picks up waste products, and then it returns to the heart by the veins. Okay, and I call the venous side often the forgotten side of the circulation because we talk so much about the arterial side, but actually, venous disease is more prevalent than arterial disease. About 15% of people have venous disorders. And venous disorders run an entire spectrum. Okay, on the lower end of things, spider veins and just pure varicose veins are simply ugly, and people don't want them. They're a cosmetic burden, and we can certainly do a lot with that in today's world. But as we start to get more and more progressive, we have pain in the legs, particularly in people who have to be upright if they have varicose veins. The valves are leaky, blood pools in the legs, it swells and it hurts. Then we have clots that can occur on the venous side. That can be dangerous. And then finally we have the two most dangerous problems with the veins. One of those is pulmonary emboli, where you have a clot that occurs in a leg vein. It breaks free and it goes to the lungs. That's one of the leading causes of death in hospitalized patients, and it's a common cause of death in the general population. And the other huge problem that many don't know about is venous ulcerations. I treat a lot of leg disorders, and so a lot of times patients are sent to me because people think they have blocked arteries, and the problem isn't a blocked artery, it's leaky veins, and that causes big ulcers that often require multiple hospitalizations. And that can be not just expensive, it's painful, and people can actually lose their lives or their legs from that.
Before we actually get more in depth about spider and varicose veins, you made a good point. It didn't get venous disease didn't get a lot of press, didn't get a lot of publicity. The heart got it all. What changed? I know y'all were changing that for years, but what changed it to the magnitude it is now?
Well, I think we've started to realize the problem. Part of what gets the attention is when we have new novel therapies where we can really help people. People tend to focus on those. And on the arterial side, particularly in the heart, we had great strides. More recently, great strides have been made in treating blocked leg arteries, in treating venous insufficiency or varicose veins. And with those strides, of course, that information starts to get out. People ask me all the time, what's the most important? I say it's all important. It really is. You have to have circulation. You have to have all three components. You have to have the pump, you have to have the arteries carry it out, and you have to have the veins carry it back, or else it is not circulation. It ends up being a problem. So you could imagine if the veins can't return the fluid, the legs swell, and they become discolored. All of those things happen. Those are signs of venous disease. When someone's legs swell up at the end of the day and they hurt, that's venous disease almost always.
You know, in previous shows, we talked about the veins, and correct me if I'm wrong. One of them, you brought up the fact that there's a valve, and we always think of the valves in the heart. But
Yes.
the valves are everywhere, and if they don't work right, it backs up back into the leg, right?
That's right. Well, what happens is, on the arterial side, there are no valves. We have a valve at the heart level to keep blood always moving in one direction, because the heart just pumps. It doesn't pump something in one direction. It's the valves that make it move in one direction. And it moves under high pressure in the arteries. It's moving from high to low pressure. But on the vein side, The vein circulation moves blood at very, very low pressures. And so what happens is only three things move that blood. One, there's a little bit pressure left from the arteries as blood is given off, but that would only push blood up about this far. There's a Latin word for that. It's called vis a tergo, which means in Latin, push from behind. But that wouldn't get blood back to your heart, especially when you're standing upright. So then the second thing that moves blood on the venous side is when we take in a deep breath. We have negative pressures in our chest. That helps to suck blood up. But for the most part, blood inches its way up inch by inch and is held in place by a series of valves. And when those valves start to leak, or if we get blockages in those veins above, which increase the pressure, then the blood cannot return.
All right. What we're going to do, if you have a specific question, look at the bottom of the screen right there. There's the phone number. We're going to take a break. We're going to come back, talk a lot more. If you have a question, give us a call.